All right, Chapter 5, Designing Cardiorespiratory Exercise Programs. Let's go. All right, so the first thing you need to do is if you don't have your VO2 max results, so I want the real ones that we did on the machine. Hopefully all of you got it. I know some didn't work, or maybe you didn't take this class for exercise phys, but it's going to be really helpful if you do have that for this later on. If you don't have that printout, you should be able to go back to exercise phys and get it out of that thing there. So you should have access to it if you don't. If not, talk to me and I can come find it. Exercise prescription. Now, it's definitely an art. It's not every one size fits all kind of thing. You have to figure out what is your client's goals. Are they trying to get more fit? Are they trying to do it for their health benefits? And that's really where this class is going towards, rather than like a varsity athlete or an elite athlete kind of thing. Those are fun, but most of your clients are going to probably be in it for either getting a little better fit or for their health. The goals are going to affect your mode, intensity, frequent duration, progress, and those are all going to come in here in just a second. All right, so there is kind of a dose relationship here. So your exercise potency is going to be the ability of that person to do a certain result. So running is a more potent than walking. So that's why we talk about exercise potency in regards to altering your VO2 max. So your goal also has to be considered. You need to also think increasing the activity in a sedentary versus habitually active person. Could have some diminishing returns there. If it's a sedentary person, going from nothing to something will cause a huge improvement. Where this is all on cardiovascular, but even it's in some ways it's the same concept as when if you go from never lifting weights to lifting weights, you see a big increase in that first little bit. There'll be a real high response. If you have an active person who's already running or is already out walking a lot, they're not going to get as big of an improvement in that area. So if they're habitual exercisers, the effect of it is going to be very small, whereas if they're completely sedentary, it's going to go up real quick. So that dose relationship could have some side effects. So the benefit of exercise are huge. Now there are some risks, and we talked about that, I believe this in exercise phys, that the increased risk of injury with increasing your type of exercise, it mostly is going to increase when going above and beyond the recommendations for health. So there's a small amount of risk of cardiac arrest during exercise, but again, that's very slim, and that's why they usually say see a doctor first. Let's see, we got here interactions with medicines. Most of the time it's going to be good. Let's see, slight risk of cardiovascular events. I already said that. Exercise as a medicine is a newer thing here. Actually, doctors are prescribing exercise, and that's where they will then come to you as a physical therapist or as an exercise professional to do that. And sometimes those can be chronic, sometimes those can be acute, is what we're going at here. So the benefits of exercise in the short term, say acute would be a short-term effect, chronic would be long-term effects, also known as training. Being sore after that first workout for up to a week would be like an acute effect there. The older you get, the longer that acute you feel for, trust me. So our book gives us a couple other ones here. Here are the elements to a cardiorespiratory workout. Generally, you're going to have a warm-up, then the endurance conditioning, a cool-down, and preferably some stretching at the end there. So that warm-up should be 5 to 10 minutes, doing a low to moderate intensity. Gradually, you want to increase the heart rate as you're going there. You want to warm up that sympathetic nervous system. So that's why we want to really emphasize the gradually increase. Sounds like something I should do with my physical fitness class. Good ideas here. And by doing this, you do kind of take out some of that cardiac issues out there. You decrease that risk, even though it's already fairly small, but it decreases even more. So then you have your endurance conditioning part. So most of us are pretty familiar with FIT. Frequency, intensity, type, and time and type. And those would be 20 to 60 minutes A single bout duration should be about 10 minutes of continuous, and if you want to accumulate more than a moderate physical activity, the one that we probably haven't seen is this VNP. And I think, are we going to go into that a little more? Yes, we will go into that a little more a little later, but that's volume and progression. Your cool down also should be 5 to 10 minutes, so your heart rate and blood pressure return to near pre-exercise levels. And we're going to maintain that venous return to the heart and prevent any blood clot pooling anywhere, usually in the legs. Counters any of that dizziness or fainting there, so you just want them to go from crazy hardcore to... If you were doing like your VO2 max test and you just stepped off, there's a chance you might pass out. So we just don't want that to happen with any of your client. You basically want to reverse your warm-up here. Don't just sit down right after exercise, because that's where we're saying that venous return there. And you've heard people say, don't sit down after you exercise. And the reason is you don't want that blood in your leg to get stuck there. And then especially the older you get, the more that's going to be a problem. Your parasympathetic nervous system will ramp up and get that blood back to the heart. And if that parasympathetic nervous system starts making things go crazy, that could cause a heart attack. And that's why we worry about either dizziness or fainting or a heart attack on the strong side of things there. All right, the last part of this would be stretching. And this is another one I'm hoping to add to my physical fitness class. I know I saw Dr. Paulson when he was teaching physical fitness. At the end of the workout, he had all of them start at the same time, and when they all finished, he had kind of a little stretching routine that they all stood next to their machines and stretched their quads, stretched their hamstrings, that kind of thing. So you definitely want to target those major muscle groups, the ones that could cramp, so calves, quads, hammies, for most running or biking kind of things there. And you just want to make sure you keep that normal range of motion so it doesn't tighten up afterwards. So here's the other ones that we kind of talked about. So we had our mode, which is your type of activity, which in this case can be endurance, your intensity, and then your frequency, duration. And then here's a little more details in there. So the American Heart Association changed everything up a few years ago, and it used to be just 150 to 300 minutes a week. And now they've actually changed that to have the exact, like if you're going to run at a vigorous, it's 150. If you're going to walk at a moderate, it's going to be 300 or some combination of the both. So I think this is updated here. So this is 5 days a week of moderate intensity and 3 days of vigorous or a combination. Your intensity, again, moderate or vigorous there, and you can see kind of the numbers there of your VO2 max. Your type is going to be aerobic, large muscle groups with fairly little skill, so running, biking. And then your duration is going to be greater than 150 minutes of moderate, and then 20 to 60 minutes of vigorous, again, or a combination. And then here's the ones that's a little different. So the volume is going to be, they really want you to have 1,000 kcals a week, or 500 mets a week. We'll get into that in a little bit. So you increase, the progression there would be increasing your client's ability to adapt. And that's going to depend on every one of them. You should follow that SMART thing there. So specific, memorable, action-oriented, realistic, timed, and self-determined. So that's the SMARTS acronym there. It's something I use in both physical fitness and weight training. As I want, when they set their goals, I want them to be, because usually they'll say, I just want to be in better shape. Well, give me something specific to go towards, rather than just, I want to lift more weights. No, I want to be able to get this much on this specific thing. And yes, those work for everything, but we're going to stay focused on the cardiovascular here. So some of the different types here is you have your minimal skill, your type Bs are going to be vigorous, your Ds are going to be your require skill and some fitness level, and then D are going to be your rec activities, and that may or may not. So playing intramural basketball may or may not improve your physical fitness, depending on how much you work. Check your book for any more examples of that one. And here's kind of where these would all go in comparison to your VO2 max. So your aerobic dancing, look how high that one is for your heart rate. Dancing, huh? Wow. Didn't think it'd be that one. Treadmill's a little higher. Inline skating's fairly high, which is kind of crazy to me because I don't feel like I work that hard when I'm inline skating. Stair stepper, Nordic skiing, and then here's our cycling and rowing machines there. So considerations when you select your type is or the mode that you want them to use. What intensity, or can the intensity be progressed? In our case, most of the time we're going to try to do that indoors on a treadmill or something, so that would easily to progress. Outdoors, a little more difficult. So does it exceed the client's exercise capacity? Is it convenient and accessible for them? Is it something that they enjoy? That's a big one. If you want to keep them going, they're not going to keep going, which is going to give you some psychological problems for your client. So the College of Sports Medicine recommends, to say this. Here we go. Using a percentage of your VO2 or your reserve. So your reserve is going to be your VO2 max minus your VO2 at rest. And that's how you can stipulate that metabolic equivalent there. So your rest is going to be approximately 3.5 or 1 metabolic rate there. So your rest is going to be your heart rate reserve. So your max minus your rest. Accessing your client's cardiovascular fitness before setting this level, or before you getting their intensity there. A little bit more on here. Some of this is a little bit doubling up here, and I think I'm going to make you calculate it here in a second. So reserve units, so 40% of your heart rate, it should equal approximately your 40% of your VO2 max. There are some errors in this calculation, especially if they have like a low heart rate. Example, an 85-year-old person's with a resting heart rate of 93, if you went 220 minus your age, their max heart rate is 120. Well, that means they're at rest, they are at 76% of their max heart rate. So they would need to work at 91. That's lower than their resting heart rate would be. So, I mean, there are some calculations that could mess up there, but generally speaking, you're going to be fine. So here's some examples here. So you're going to take your max minus your rest times the percentage plus rest. So if your resting heart rate is 70, your max is going to be 180. So that would be a 40-year-old there, 220 minus your age. And then so your VO2 at rest is going to be approximately 3.5, and your max, hopefully you can get this from your VO2 max thing there, would be this. And then here's how that would calculate together. Didn't think you were going to be doing math in this class. You're welcome. All right, so try this again. Hopefully you got your VO2 number there, or you just remember what your max was. And I want you to try to put this one in here, and I'm going to make a question for it. Go. All right, keeping going. So the setting for initial exercise intensity, adults with poor cardiovascular fitness going from 30 to 60% of their VO2 or their heart rate max there. So for the apparent healthy adults, you want to do 40 to less than 90. And if you're trying to improve the cardiovascular, 55 and up to 80. So that's what I would probably be doing in my physical fitness class. Aerobic fit people need to have less, or may need higher intensities than on here. If there are, yeah. So setting some of those intensities, you're going to plot your heart rate and VO2 or MET levels from a graduated exercise test. Identify the metabolic zone, and that's what you got in your VO2 max thing. It gave you different zones to exercise in. Taking that VO2 rates, or resting, and multiply all that together. So knowing your target intensity identifies your corresponding heart rate. And there actually, for your VO2 max test, there is an app that goes with that machine that you could use with a heart rate monitor, and would do it all for you. So generally, here's your heart rate zone and your target MET zone. So at about an average person here having 130 to 175 would be 60 to 85%, and that would give them 7.4 metabolic rate equivalents, and their max heart rate would be 195. So again, your intensities are going to be, the easiest way is probably do the heart rate method. I know we just made you do all that, and I tell you this is the easier way. Also known as the Carvinian method. Probably should have found a video about that. And so then you could take your max minus your rest will give you that heart rate reserve. That's the same thing we did just a second ago. You can also use the percentage of your heart rate max to get a target heart rate. Probably I've done that one more often than the other ones. This way is going to be more specific. This one's a little more general if you're going to just do it off of their percentage times their heart rate max. which is what I have my students do on the first or second day of physical fitness class. So here's just kind of a general one here of what would be considered if they're a poor classification. Heart rate percentage is going to be about 30 to 45, and their max would be, percentage of their heart rate max would be 50 to 60. And hopefully their rate of perceived exertion is going to be light to moderate. And that can go all the way to a really excellent runner who are going to be running at 70 to 90, and they're going to be hopefully saying it's somewhat hard. All right, so a couple other ways to generally know how someone is exercising. The talk test is good. If it's easy for someone to talk, we'll call that low intensity. Like if you can have a conversation with somebody. I remember watching joggers running out at the start of this, they call it the Keystone Trail near my house. They would run along the storm drains in Nebraska. There is where they would put jogging things. And these guys would be on a full out run in their super short shorts and tank tops. And these guys are running along, tons of F-bombs, and they're just having a whole conversation while running faster than I could probably run. So for them, that was low intensity. Able to talk but not sing would be a moderate intensity. And if you're having a hard time talking, vigorous intensity. So easy to talk, can't sing, or tough to talk would be low, moderate, or vigorous. A little more easy way to check that rather than trying to calculate it all out there, though it's good to be able to calculate it. And we already talked about this one of why it's a 6 to 20 and how that should go close to what their heart rate is. And if you're going to do that on 1 to 10, this is where it would look like. So make sure when you do any of your heart rate things, you explain to your clients why you're using this scale rather than just telling them on 1 to 10. So measuring is key to your client safety, to proper workloads. That's why we check all that earlier. Do a talk test during. This one they have a counting talk test. I couldn't find much on that one, so that must be a little older concept there. So we did talk about frequency. I say they changed it up here recently to 3 to 5 days a week with a couple extra things in there. So 20 to 60 minutes of continuous or intermittent activity per day. Cardiorespiratory fitness improves with moderate physical activity lasting at least 30 minutes to 60 minutes. And you can add 5 to 10 minutes as they get better at their goals. That's why I start my physical fitness class at 20 minutes and we work our way up to 30. So volume is going to be this is the new one probably to you. Volume is frequency times intensity times duration. And your metabolic per week load that you're having them do. The ACSM, American College of Sports Medicine, recommends 500 to 1,000 metabolics minimum per week. And that translates to about 150 minutes, wow, of moderate physical activity per week. And with your pedometers, that would be 5,000 to 8,000 steps. I'm generalizing here. And that's why they have that 10,000 steps per day goal on most of your smartwatches. But you'll also notice that if you have an Apple Watch like I do, you have your exercises per day, and then they have like how many calories, and that's where it's actually taking the metabolic rate and converting it into calories for you. So your volume, this probably should be the first thing you're looking at when you're trying to make an exercise prescription. I know the acronym is frequency, intensity, time, type, volume, progression. Really, we should be looking at volume first when it comes especially to cardiovascular. So minimum exercise recommendations for volume would be 150 to 300 of moderate, 75 to 150 of vigorous, or combining. And here's some examples there. I'll let you read those. The second option would be to say 500 to 1,000 metabolic units per week. So then that would be 20 minutes of activity 5 times per week, with more difficult than resting. So 5 meds times 20 minutes equals 50 or 100 metabolic minutes. So an exercise prescription 3 would be 1,000 kcals expended per week through exercise. And you could actually calculate that with cardiovascular exercise and lifting exercise to get those kcals all moderate out there. So you as the professional needs to know how to do that for your client. Sorry, you got to do a little bit of math as a professional. And I have a note over here that said moderate is worth 1 met, and vigorous is worth 2 mets. So you could actually say if it's harder exercise, you can call that more mets per time. And then progression, let's see, this one has kind of have your initial conditioning, your improvement's going to be in that 4 to 6 months, and then maintaining whatever you get to after 6 months. And so here's the College of Sports Medicine's one in that progression. Same concepts here. I don't think there's anything new other than regularly retest. So yeah, so let's see. I've got never increase more than one of the fits in 1 week. To increase past your health benefits, you need to, or to increase health benefits, you need to increase your progression there. Probably the easiest thing to, or easiest way to think of that. So there are some training methods and modes here as you have your continuous ones, and then you have some more discontinuous where you kind of have a low to high intensity bout. So that would be like fit things that you would be doing there. So that's kind of a more, or some circuit resistance training. I love doing that, and I haven't been as good at making my classes do it. But I do enjoy having a day right before we up the intensity where I actually time them and do a whistle where you've got 2 minutes to get to the next machine, lift 25, and then I'm going to blow the whistle and you go to the next one. And it kind of turns into a lifting resistance, but doing it quickly so that you're actually getting a little bit of an aerobic exercise at the same time. So let's say more of this here. So like sometimes type is called mode is what we were calling it earlier in our book. But I've always called it type. So you can have rhythmic aerobic exercises, and most of this one's being specific here. The training event should include a mode that maximizes the effect. And most of these are, run to run. So with no goals, people tend to stick to a single type. So it is probably good to say, change it up this week. Let's do bike this week. Let's do running this week. So that people don't get bored. And overusing the same muscles also will tend to do that. So supervised programs versus unsupervised. So a supervised program is recommended for a high-risk individual. So if you are worried about their heart, you're going to want to be there the whole time. A novice that's never used any of the equipment, or just participants who don't have a lot of motivation. Unsupervised, though, you can probably prescribe it for them and trust them to go do it. And that's recommended for someone who's already fit, an individual who's low risk for any cardiovascular disease, and all those types of things there. I think this is my last one. So also consider your environment. I know we had a whole couple of days about this in Exercise Phys last quarter, but I just got to throw it in here. Make sure you alter your prescription based on the environment. What time of year is it? Is it hot right now? Is it cold right now? Is it rainy? I mean, about this point in Northern California here, it's raining. So recommending a jogging class outside in the run is probably not the smartest thing. A lot of places got ice and snow in January, early February here. Also make sure you keep an eye out for lighting. That's why I made sure I had this red light here. I tend to like to go biking. And when the sun's going down at 5, I got to make sure I got extra lights. I got 2 lights on my e-bike that I go biking in most of the time. And then any other things like tripping hazard. Oh, and humidity. Holy cow. Got to mention that one. Make sure that, I had this team come when I was in Arizona, in Thunderbird Academy in Scottsdale, Arizona, in the valley. And this team comes down from almost the Grand Canyon to play us in soccer. This team came in August. Now, up near the Grand Canyon, it was probably 70 degrees, maybe 75. They got on the bus and they drove down to us. It was 95 over to 100 when they got to us. They had to come down several thousand feet into the valley, and they tried to play us. We romped the game, but more importantly, their players were dropping in heat exhaustion, not just like seriousness. I remember coming after the game. I didn't actually see the game itself, but I saw the aftermath as I come into the gym, and there are paramedics. That was my first clue that something was wrong, is when there's 2 ambulances there and paramedics with these players with IVs in them to try to rehydrate them because it was so dry and so hot, and they were definitely not acclimatized to it. They ended up staying in the dorms at the school overnight to recover because they didn't want to drive them back in the heat of the day because it was early in the year and it would have been driving in 100+ degree heat in a bus when they're already been hooked up to an IV. So they let them sleep in empty dorm rooms that just had beds in them and sent them back, and they got on their bus and drove back the next day. So, oh man, be really cautious of your exercise prescription based on the weather. And humidity is probably one that we don't consider enough. If it's really dry, a lot of places in California here is more dry than others. Even just the difference between Angwin compared to Napa Fairfield. It's going to be more dry in Napa Fairfield than it is up in the top of the valley. So just be cautious of those things. And when you're making your prescriptions, be careful, be cautious, and always err on the side of caution, I would say, with your exercise prescriptions. Make sure you text me, email me, any questions you have about this chapter.